Secretary Wiesman, thanks so much for joining us. First question I have for you today is how you would assess our state's response to COVID-19.
Great, well, thanks for that. I would say that we're having early success. We had achieved our initial goal of not overwhelming our healthcare system and being able to see the patients that we need to see, and doing our best to try and prevent as many infections as we can. So I would say early success with a lot of partnerships out there helping to make that possible, as well as I would still say, though, precarious, that we are still in this time when people need to stay home, stay healthy, so that we really can keep and bring our infections down even more than they are right now.
What is your role in helping to guide what we do in terms of policy and timing?
So my role really is about looking at the data, understanding the epidemic that we have here in Washington, looking at what's happening around the world and understanding what prevention measures seem to be effective, and then working with the governor and others to translate that into policy and into our approach. So it's really trying to focus on how we prevent as many infections as we can and keep people as healthy as we can.
Since not all of the states are doing the same things at the same times, and I recognize there are differing situations in various areas, but we don't have any national CDC guidelines finalized yet that would let us know what the norm should be. Does that interrupt or somehow cause, problems with the way we deal with this individually? For example, if we're doing one thing and Idaho's doing something else, what does that do to our situation?
Right. Well, one, we're all trying to figure out, I think, the best paths forward that make sense for our state and our local conditions. National guidelines are always helpful to give us something to take a look at, but those guidelines then also need to be flexible and allow states and local communities to adapt them to what makes sense in their local conditions. So, we're moving forward, and we do have contact with the CDC around guidelines. They develop many guidelines that are out there that we use and inform our decision making on how we're going to move forward.
So tell me about the complexity of trying to figure out what opens when and how.
Yeah, it's quite complex. We're trying to look at a number of factors. One is we're trying to understand, so what's the risk with some of these behaviors and what ways can we modify that risk so that we can open as safely as we can. We're taking a look at how much can we do at once. We're trying to minimize the amount of movement that occurs at once so we can kind of see what the effect is. We're also really concerned about populations who have been disproportionately affected. Folks of low socioeconomic backgrounds, racial ethnic disparities, and where have they been impacted, and how might we look at first go for them who have been really most disenfranchised or challenged by this, as well as the economy, and looking at what sectors really drive some of the most economic gain in the state, and trying to put all of those things together and balance then what seems to be a reasonable path forward.
Who has the final responsibility for workplace safety when people do return to work?
I think ultimately it's a shared responsibility. Obviously, the employer does. The employer has to create safe conditions for employees to come back to. They have to have the right policies in place, things like screening employees as they come in, having environments where they can be 6 feet apart, and creating environments where one could telework if that's a possibility. So the employer has a lot of responsibility. And for setting the structure and the stage, I think, for us to be successful. But then it comes down to us as individual employees as well. We've got the responsibility to pay attention to our hygiene. We have the responsibility to make sure we're not coming to work when we're not feeling well, and that we're monitoring our physical distance as well, that we're not getting closer than 6 feet to folks, that we're not congregating in our common areas. So really, it's a shared responsibility, along with state oversight in terms of giving guidelines and recommendations about how to safely return to work.
How important is testing at this point? When will we get to the point that we have enough, and why don't we have it now?
Testing is really important, in part that we can quickly identify individuals who are infected so that we can get them to be isolated at home, get the health care they need, and not transmit this infection to others. So having that awareness and that testing is really important. You know, this has been so frustrating. So for so many of us, we have just run into supply chain issues all the way around with testing, and we're still struggling to get enough swabs and viral transport media for the sample collection. The federal government indicated that they were going to be giving us supplies, about 500,000 or more of swabs and transport media in the month of May and then again in June. Those are not coming quickly to us, so that's been really frustrating as we all try and move forward, because we do see that as important. You know, if somebody is ill in a workplace, we want to be able to very quickly tell if that was COVID or not, so that we can know how to respond with the workplace.
Let's talk about vaccines. We were told, first of all, that this was 12 to 18 months away. You know, everyone was sort of hoping that would be the soonest time horizon. Moderna has gone ahead a little bit. There are others that are being investigated. I think about 100 that are in labs, correct? And 8 or so in trials. So what makes this such a complex thing that it takes that long to come up with a vaccine that is effective and safe?
Well, developing a vaccine is sort of a complex process. First of all, you have to get the product to test, which obviously, as you've indicated, we have a number of vaccine candidates out there. Then you've got to test it on people to make sure it's safe. So that's what we call the phase 1, is giving the vaccine, the potential vaccine, to folks, make sure they don't have any negative reactions to that. And you have to do that with a certain number of people to test for the safety. Then after that, once we think it's safe, then it has to be given to a much larger group of people to determine whether or not it continues to be safe as well as effective. And that means that enough people have to get it. They have to be living in communities that have, in this case, COVID-19, and that we can test whether or not the vaccine is actually preventing them from getting infected. And all of that takes time, as you might imagine. That time for testing the effectiveness can be as much as a year or more. And then again, that's assuming that the vaccine actually works at the end. And then you have to produce it. You have to manufacture it and get it out to folks.
And that's my next question, is that if we don't have swabs and reagents, will we have vials and syringes and rubber stoppers, assuming this is an injection? Are we ready for that kind of production?
Well, that's a great question. And I would hope that at this point, the federal government and others are working on those products, on producing the vials and the syringes that need for a mass vaccination program. This is one of those things where we've got the luxury right now of time, where we don't have a vaccine right now, so we need to be working on stockpiling those. And that would be something that I'm hoping that the manufacturers and federal government are doing. And we'll have to be looking at that here in terms of looking at stockpiling syringes and those kinds of things.
Okay, so we're hoping, but do we know if it's happening?
At this point, I don't know that that's happening. I must say, at the moment, I'm very focused on trying to contain this outbreak and get testing in our state. But we are looking towards, the fall in terms of flu season, and thinking about, I would hope that we'll see a lot more folks getting a flu shot this year as well. So we'll have to prepare for that, as well as down the road a potential.
Well, that was my next question. What happens over the summer? What happens in the fall when we hit influenza season? And do we have the capability, if we've reopened some things, to shut them back down if things get out of hand?
Right, so we are planning for all of this right now. We're planning for vaccine flu clinics, and again, hoping to see an uptick in those. We're planning for surge capacity in our hospitals. Usually during the respiratory season, we see hospitals getting pretty full usually. So we're concerned about what that will mean this year if we have flu and COVID happening at the same time. But our hospitals have been exercised, certainly with the COVID right now and the surge capacity they were creating, but they're also preparing again for the fall. and how they could add additional beds to their hospitals. And we've really worked through now a lot of the regulatory things that we would need to sort of waive in terms of allowing folks to have the surge capacity they need. So we're in a much better position for the fall, certainly than we were for the beginning of COVID.
Is this virus mutating? Do we have any evidence of that? Do we know whether the strain on the East Coast and the West Coast were different?
You know, researchers are paying close attention to that. At this point, it doesn't seem like we're seeing a difference of anything being more virulent. But that's always a concern with viruses, and it's important that we keep monitoring that along the way, and that our researchers examine that.
Apparently, it's a fairly rare occurrence, but there's some startling information out of New York about the deaths of children who had a strange inflammatory disease and had earlier been infected with COVID. What can you tell us about that and what parents should know?
Right, well, you know, again, this virus is new, and there are just so many things we don't know about it. We don't really know what are all the sequelae that people might have from becoming infected. This might be one of those that some kids seem to be having this immune response, which is affecting their heart and their kidneys and causing abdominal pain and other issues. So it's early on in understanding this. We're working with the federal government right now to try and identify, well, what is kind of a case definition for this so that we can ask our clinicians to take a look for it. But the UK described it, I think, at the end of last month. New York, as you said, has talked about a number of cases recently. And we're certainly working with our hospitals here and Children's Hospital to see if we can identify any potential cases there.
Do we know of any cases so far?
I think Children's may have identified a couple of cases that they think might be related to this. So we're working with them to better understand the situation. And we'll be probably putting out an alert to all of our healthcare providers to be on the lookout for this.
All right, that's very important. What do you think about this idea of herd immunity, population immunity? Are we misunderstanding what that means or what it would mean to get there without a vaccine?
Well, you know, really, this is why the vaccine development is so important, is we're really trying to get folks who can develop the immune response. You know, the conversation we just had about kids right now talks about the risks of people who might try and intentionally become infected with COVID. You know, you've heard of these so-called COVID house parties, perhaps, where people try and intentionally become infected to develop natural immunity. Well, there's a number of challenges with this. Number one, as I just said, we don't know all the sort of disease processes that might occur from having COVID or the other effects long term. So that's something that's really unknown at this point in time. And we also don't know how long the immunity that develops actually will last, and is it actually protective? So there's really some downsides here to thinking about trying to intentionally become infected. It also means, though, that we need to really pay attention to all those things we've been talking about, our hygiene, staying home when we're ill so that we don't become infected.
Will we do things like shake hands again, go to ball games, you know, hug each other, get close to strangers, go to a fun, noisy, packed restaurant? Are those things going to come back? Or are we going to be changed on a more permanent level?
Those things will come back. It's not going to be in the very near future, I can tell you that. So there are those things that we're going to have to understand for some period of time, you know, maybe as long as developing a vaccine, that some of those things just aren't going to return to where they were until that point in time. It's something that we're carefully paying attention to. We want people to keep their physical distance right now. We want them to pay attention to their hygiene. And you know, large crowds right now are just not something that's safe to do. And we need to understand that and understand that shaking hands isn't it right now, but we can do the, you know, the high five, air five, or the, you know, kind of elbow bump to someone.
Air hug.
The air hug, indeed. All of those things are going to be with us for a while.
Just a couple more questions. Air travel, public transportation, is there any way to do those things safely in the interim until a vaccine is here?
Well, again, this can be things about paying attention, doing your best to keep your physical distance, not touching as many objects as you can. And as soon as you get off of a bus, for example, have hand sanitizer with you and use your hand sanitizer so that if you touch your face, you're not going to transmit any of the germs. Wearing a cloth mask is another piece. So it's the basics really around all of this. And this is about how we're going to return safely to work as well with those basics around the good hygiene, staying home if you're ill, wearing a cloth face mask if you can't keep your distance from other folks.
What worries you the most about this pandemic right now, and what gives you the most hope?
I think what worries me the most is the impact this is having on people. I mean, we've talked a little bit about it. Certainly the unemployment for individuals, the mental health challenges that might come along with just this inability to have some of that close physical contact with people, and how this is really very disruptive to people's lives. We understand that this is an extreme hardship for many. And so I worry about that. I worry about the impact on people and the long-term effects on families and children. The thing that sort of gives me hope, though, is that I know that people pull together in times like this. It's neighbor helping neighbor, it's family helping family. And, you know, the Nextdoor app, for example, is one of those social sort of neighborhood apps. And I see people who are reaching out on there to help each other out. If somebody says they need something, they're there to help them. So what gives me hope is people and community coming together, all of us working through this together and supporting each other. And that's how we're going to be successful. And in Washington, that's the way we do things.
Thank you so much, and thank you for your hard work. And I know this has got to be, you know, more than a lot for you and for your staff, and I just want you to know we all appreciate it.
Thank you, and wash your hands, stay safe.
I'm washing them like I'm Sanjay Gupta scrubbing in for surgery, let me tell you.
All right, good for you.
Thank you so much. Thanks for your time.